Good afternoon and welcome to the St. Clair County Daily COVID Briefing. I'm joined today by EMA Director Simmons and Sam Bierman from the Health Department. Sam, you have today's numbers and they're not as good as yesterday.
No, they absolutely aren't. And keep in mind today, when we are reporting, we are about 500 tests short from what we were yesterday. So as of today, 131,262 St. Clair County residents have been tested, which is an increase of 1,284 from yesterday. We have 11,239 positive test results, which is an increase of 208 from yesterday. And that does include both males and females from under the age of 1 up to their 90s. And I would like to note today that we've had people say that in past briefings that, you know, this is hitting the older population and today more than others. And I don't think we've ever had two, but today we've had 2 positive test results for 2 children under the age of 1. And they are more likely to be susceptible to this virus. They don't have the immune systems that older adults do. And so, you know, if you've got small children in the house, even more of an incentive to, you know, follow those 3 W's, continue to keep your distance. Our daily county positivity rate today is much higher than yesterday. We are up to 16.2% today. And we are at 120,023 negative test results. Unfortunately, we are announcing an additional death today, which does bring our total for the county to 231. That was a man in his 90s who did have underlying health conditions. And as always, our sympathies go out to his family. For those who have completed the IDPH required 10-day isolation period, we are at 9,377. For state totals, 8,871,640 have been tested, with 551,597 positive test results, which is an increase of 15,415 from yesterday. 15,000 positives in one day. That, when I saw the number come out today, that blew my mind. I mean, that is by far the highest one-day total we've had for the state since we've started this response.
Yes. By several thousand.
Yes. For deaths, the state is reporting 10,504, which is an increase of 27 from yesterday. For hospitalization numbers for St. Clair County, currently we have 83 individuals that are admitted due to COVID-related reasons, and 11 of them are on ventilators. Regionally, we have 172 patients that are admitted due to COVID-related reasons, and 23 of them are on ventilators. For congregate living facilities that are in outbreak status, that is currently or previously, these are cumulative numbers, we will only announce any facilities that have had any changes. Brightly Senior Living has 20 cases and 1 death, which is an increase of 1 death for that facility. Cambridge House of O'Fallon has 9 cases and no deaths, which is an increase of 1 case. Caseyville Nursing and Rehab has 42 cases and 2 deaths, and that is an increase of 7 cases for that facility. And Marca Nursing and Rehab has 24 cases and no deaths, and that is an increase of 12 cases for that facility. We do have some testing coming up this weekend, both Saturday and Sunday, the 14th and 15th, from 8 a.m. to 4 p.m. on both days, and that will be held at Belleville West High School. If you need any specific information on that, both the Health Department and EMA pages have that specific information. And I will turn it over to Herb for his update.
Thank you for that report, Sam. Appreciate it. And we'll go into the zip code report as we do. Chairman Kern is at another meeting today, and so we'll be filling in for him. Zip code report 62201 goes up 3 to 328. 62203 goes up 5 to 327. 62205 goes up 12 to 290. 62206 goes up 5 to 591. 62207 goes up 1 to 321. 62208 goes up 9 to 648. 62220 goes up 13 to 816. 62221 goes up 21 to 1,037. 62223 goes up 10 to 712. 62225 goes up 5 to 59. 62226 goes up 19 to 1,210. 62232 goes up 16 to 310. 62239 goes up 3 to 163. 62243 goes up 8 to 211. 62254 goes up 11 to 368. 62255 goes up 1 to 23. 62257 goes up 3 to 79. 62258 goes up 16 to 354. 62260 goes up 7 to 263. 62264 goes up 3 to 130. 62269 goes up 31 to 1008. 62285 goes up 7 to 219. 62289 goes up 1 to 13. You heard Sam's numbers. Our daily county positivity is up to 16.2. That's up from 8.6 from yesterday. Going in the wrong direction still. The 7-day rolling is at 15.3, which is up from 14.8. The regional positivity rate, 14.8, which is up from 13.9 yesterday. The daily county positivity rates for the other counties in the region came in today. Bond County, 13.8%. Clinton County, 28.4%. Madison County, 18.5%. Monroe County, 17%. Randolph County, 16.8%. St. Clair, 15.2%. And Washington came in at 24.3%. As we say all along, the numbers just continue to go up. They have been. One new death to report. One is too many, as we talked about, Brian. We've been saying now for the last week and a half, these numbers are just going in the wrong direction.
They are. The numbers are increasing tremendously, and something that we're getting questions about a lot on the page that I kind of want to revisit here for a minute is we talked about this the other day, Sam, when the health department, IDPH, announced they would begin adding probable cases into the positivity. And just to clarify, what they're talking about there, a probable case was someone that had a rapid test positive and they were waiting on some type of lab diagnosis. Is that correct?
So that is correct. When they are talking about a probable positive, that is a test, an actual result of someone who has had an antigen, more likely what we're calling a rapid test. They actually have a true lab result. And when we are talking about a presumptive positive, that's some of the questions we've been getting as well, is what's the difference between a probable and a presumptive? A probable is someone who actually has a test result of a positive or a negative, which we have been counting from the very beginning. So the numbers that we have reported for St. Clair County daily from the very beginning have included the probables that we have received. And a presumptive is, let's say someone, a husband and a wife live in a house together. A wife is positive and the husband lives in the house with her. Maybe a few days later, he becomes symptomatic. He is what we would call a probable. He lives with a presumptive. He lives with someone who has a actual test result, a positive test result. When we talk about someone who has, that we are going to consider a presumptive positive, they do not have a test result. We are simply going by the science and saying they live with someone who is positive, we have a test result for that, and now they are symptomatic.
And those people are not counted.
That is correct.
In our positivity rates unless they go and receive a positive test result themselves.
That is correct. We do not count anyone unless they have a lab report that has their name and a positive or a negative with that.
And I think that was very important, something that we needed to discuss. Mm-hmm. We get lots and lots of questions on that. And these numbers are rising tremendously. Yeah. We put a message out last night on our page. 4 more school districts here in St. Clair County are having to modify their learning plans because of either positive cases or exposures. And I don't know what else it's going to take to make people understand that this thing is real and this thing is growing. And, you know, Dr. Ezike made a very important statement today about quit asking what everyone else is doing to stop this. What are you doing yourself? Are you doing everything that you can possibly do to help slow this spread down? Are you making wise choices? Because it just takes one careless mistake of maybe going to a social gathering that you didn't need to go to, or choosing not to wear a mask because you didn't think it was the cool thing to do today, and having those private gatherings when you invite a bunch of people over to your house and everybody's in a confined area. Those are the choices right now that we need to take a break on, that we need to make sure we're doing the right thing for us, which is going to help everyone else.
And Brian, I can tell you specifically today, we received a test result of someone who was positive. They had approximately 100 contacts that went along with one case. So today we had 208 new positives, and one of those positives had approximately 100 contacts.
And so that puts a stress on the contact tracers. Because
Exactly.
they're gonna have to make all those contacts.
And that is one positive out of 208. So what else is going on with that 207? So, when we talk about that ripple effect, it doesn't affect just you or, just your household. It affects everyone that you were around.
Right. Well, I think the other number that we've been announcing here lately too is, out of those cases, 91 of them was below the age of 40. So I think that goes along with what you're saying with the 2 under the age of 1, but it's everywhere now. I mean, at all age groups. And as we said the other day when we were given some of the statistics on the deaths, this virus doesn't know your age, it doesn't know where you live, it doesn't know your religion, doesn't know your political affiliation. It just knows that it's looking for a place to get to. And if it can, it's going to. And that's the ripple effect we're seeing here. We keep saying it, and you're going to keep hearing it as the days come. With the holidays coming up on us, we're really concerned about that.
This was the Halloween response that we're seeing, this increase of cases. This was from Halloween.
Yeah.
If this was the increase that we're going to see from Halloween, what are we expecting for Thanksgiving and Christmas? Which is why it's even more important now. We're going to have people coming home, from out of town, coming home from college. It's very important to make wise choices as these holidays approach.
Yeah, well, I think we got to. If we want to get these numbers going in the right direction, we've been saying it, and I'll say it again today, there's probably more mitigations that's going to be coming down with some of the phone calls we've had today with IDPH folks in the governor's office. Early next week, we've got to, over the weekend, the math shows us, Brian, that these numbers are going to increase.
Yeah, it's just going to keep rising. We can look at what we see today for daily county positivities in the other counties, knowing that regional number's 3 days behind. We've got a pretty good idea of where we're going to be in the next couple days, and unfortunately, it's not going down. That number is continuing to rise, and when that happens, we're seeing bigger impacts on our communities. It's going to affect more businesses. It's going to affect more schools. We hear every day people are saying schools should be closed, and others saying schools should be open. And I can tell you, these school districts are doing a phenomenal job at doing everything they can to keep our children safe, to keep our children educated, and they're trying to keep them in the classroom, but they're fighting a losing battle because of choices that people are making that, unfortunately, are causing bigger problems, and we've just got to get through that and understand it's going to take everyone working together to make sure we combat this.
Well, and that's why Chairman Kern made the decision yesterday, starting Monday, the county courthouse will be closed to the general public. Services will continue. Those who can work from home will do so. We strongly suggest if you still have business to do, call the department that you're looking for, and they'll tell you how to get your business done. But that's just another step, I think, in trying to be proactive. Right now, that's what we got to be. We've been on the reactive side of it here. We got to be proactive, even more so. And Team St. Clair, we say it each and every day. We thank yous, for each and every one of you for sharing these briefings. We're seeing more and more people join it each day, leaving your comments, all the good ones, even the bad ones. We try to answer all of them. To all those who still haven't been convinced, I saw some today. It's just a flu. It's going to run its course. The thing is that we talk about this. We talked about it after we listened to Dr. Ezike today. You can go get a flu vaccination if you want to, but you can't go get a vaccination for COVID yet. So I don't really want to hear about this as the flu. Let it run its course, because we just lost another person, one of our citizens in St. Clair County today. We're up to 231 citizens of St. Clair County that don't have that choice anymore. And I know you get tired of me hearing it, but I don't care. We're going to continue to say it. Dr. Ezike said it today. You heard Brian say it today. You got to step up. What is it going to take to make you understand? It's not just here in St. Clair County. It's just not in Monroe County. We were told today that Columbia shut their courthouse, and who else was it?
Columbia and Waterloo City Halls.
So they're being proactive. People have got to realize that it's all over. You can turn on any news channel, whether you believe it's fake news, real news, whatever you want to believe, it is all over the country. These numbers are increasing. And right now, we're concerned about Region 4 here in our area. All those counties that surround St. Clair County, we're in this together. We're in this boat, and it's got some big holes in it right now. And we have got to get those holes filled up because we're sinking because these numbers are continuing to rise. So please do your best to continue to share this briefing out. Tell your friends, your families, and we're going to get this done. It's just going to take a little while longer. So please hang in there with us, and everybody be safe. We'll be back in a few moments to translate this into our Spanish communities, and then we'll be back tomorrow for day 246. Have a good evening.
I have battled this virus both professionally and personally. Professionally, I can tell you firsthand that it's greatly impacted our community, caused the loss of many lives, and continues to spread today. Personally, I can tell you that I contracted COVID-19, and it definitely is not the flu. This virus affects everyone differently, however, many have severe consequences. Please take this time to help your friends, your family, your neighbors, and the entire region by wearing a mask, washing your hands, and watching your distance. Together, we will overcome this invisible enemy.